As Mark said, I've been asked to talk about NIHR, the National Institute for Health Research, and how the ARC plays into our priorities. I'm the co-lead for NIHR with Chris Whitty, the Chief Medical Officer. Now, given we've got a lot of public contributors and charities and so on in the room, I'm aware that some of you may not be aware of NIHR. So what I'm going to do this morning is give you a very brief overview of who we are and what we do. And I'm going to talk about how the ARCs play into NIHR strategies. And then I'm going to end by just articulating my challenge for you as an ARC. So if I can have my first slide, please. Thanks. So NIHR's mission is to improve the health and wealth of the nation through research, and we do that through a variety of different means. So we fund high quality research to benefit the NHS, public health and social care. And we're a really diverse funder. So we fund, say, in the field of cancer, from research on immunotherapies, which have been used to treat children with leukemia successfully, through to research on whether being a participant in a choir can help with well-being after you've had surgery for cancer. We put a lot of emphasis involving patients, public carers, service users and so on in our research at all stages of the process. So everything from prioritisation right through to dissemination of the results of research. We fund the training of a diverse range of researchers, so doctors, nurses, but right through to methodologists, drama therapists, art therapists, and so on. So the whole gamut of people who are involved in research within the health and care system. We fund infrastructure, that's basically people. We buy out people's time to support research that's funded by NIHR, by other government funders, such as UK Research and Innovation, by medical research charities, and by industry. And we work closely with all sectors to try and ensure that we've got a coherent research ecosystem in the UK. And lastly, we have some official development assessment funding, which enables us to fund global health research to benefit people in low and middle income countries. But I'm not going to be talking about that today. Next slide, please. So just to bring some of that to life, you can see here a bit of data about the numbers of people that we're funding in various areas. So we fund about 10,000 people who are involved in delivering research within the NHS. At any one time, we've got about 1,000 active projects in health and care research that we're funding. We have about 2,000 people who are holding personal development awards with us, but we do actually fund a larger number of people through our infrastructure as well. And then we recruit about 1 million people into studies supported by NIHR every year. And in fact, today we are celebrating and saying thank you to the over 1 million people who've been involved in COVID research since the beginning of the pandemic in the UK over the last year. Next slide, please. So next slide, please. I often find that it's our public contributors who get to the heart of the matter in discussions, and this slide shows what one of our lay members suggested ought to be the strapline for what NIHR is all about. And he said that NIHR should be focusing on evidence to enable people to be born well, to live well and die well. And for me, that really gets to the essence of what NIHR is. So moving on then to ARCs, next slide please. ARCs are applied research collaborations, and they are a collaboration between an NHS trust, which acts as a host for the ARC, with other NHS organisations, commissioners and providers, providers of care, local universities, charities, the Academic Health Science Network, local authorities, and basically any organisation that's involved in research or delivery of health and care within the locality. And their purpose is to generate evidence that's going to benefit local populations and the local health and care system, and to work in partnership with others to speed up the uptake of that research evidence. We've got 15 ARCs across the country. You can see them on this slide, and they also work in partnership on national priorities. Next slide, please. So how do the ARCs fit into national priorities for NIHR corporately? Well, this slide identifies some of our key areas of focus. So not surprisingly, as a national funder, in fact, the biggest national funder of health and care research in the country, we are supporting research to help the NHS and the care system recover from COVID and to learn from COVID. And in fact, ARC West has already played a really important part in generating evidence to support the system to respond to COVID. So that's included evidence synthesis to look at the impact of COVID on mental health, to look at the differential impact of COVID on people from Black and minority ethnic background, to look at how demand for primary care has changed during the pandemic. And as part of a national endeavour, the ARC's been working with the Beneficial Changes Network, which looks to identify changes that have been brought about by necessity through the pandemic, but which actually have been beneficial to the system and will benefit from being hardwired into our future health and care system. Next on the list is a real focus, not next slide, just next on the list. So can you go back a slide? Thank you. So next is the importance of us really upping capacity for research in primary care, social care and public health research. And you'll hear from later speakers about how the ARC is supporting those key areas of priority across the country. We're also looking to generate more evidence about how we prevent ill health, including issues like mental ill health and obesity. And ARC West is active in the area of preventing suicide and self-harm. Health inequalities are correlated with ill health, and sadly for those who suffer more social deprivation, they have more ill health. We're looking to develop evidence on how we can reduce that differential and remove health inequalities over obviously a long period of time, but nevertheless making progress slowly and positively. Multimorbidities or multi-long-term conditions start to accrete when we are quite young. So people tend to think of multimorbidity as something that's just about old people. It's not. Sadly, young people also have long-term conditions. And again, there's a correlation with health inequalities. So we're looking at what we can do to better identify long-term conditions before they arise, so that we can develop things to prevent them, but also to help people live better with long-term conditions. And ARC West has a particular area of focus, looking at how we can provide better coordinated care for people and integrated care for people with multiple long-term conditions. And then lastly, we're looking at how we can better ensure that research is conducted with the communities and people who are most likely to be impacted by the research. Often researchers tend to work with collaborators that they've known for years, or people who happen to work down the road, because that's an easier thing to do. We're looking to put levers and nudges into the system to make sure that the research that we fund is really reaching out to the communities who are most in need of the evidence. Next slide, please. Next slide, please. So there are also a number of areas of underpinning work that we are taking forward through NIHR corporately and to which the ARCs contribute. So one is about how do we make sure that all the different things that NIHR funds, different forms of infrastructure in particular in our schools, work together to make sure that they're more than the sum of the parts. And I was really, really pleased to hear about the establishment of NIHR Bristol, which brings together all the organisations funded by NIHR that are hosted in the Bristol area. Equality, diversity and inclusivity is a major challenge for our community in general. It's also an issue for research funders. We are looking particularly at how we can improve equality, diversity and inclusivity in NIHR as an organisation in terms of the people who work in our coordinating centres, people who populate our funding panels and our strategy board, and also the people who participate in research that we fund, so that we can try and ensure that it's reflective of the communities that NIHR serves as a whole. Now, if we're going to tackle effectively the challenges of the health and care system now and into the future, we need to bring in a much broader range of disciplines and methodologies. And it's really pleasing to see the focus that ARC West has on those methodologies, be they health economics, qualitative methodologies, application of behavioural science to health and care research, and a real focus on making sure that applied health researchers and just forgotten the word that I'm looking for, allied health professionals play such a major role in the ARC. Now, we've seen during the COVID pandemic the importance of data to really helping insights and progress. And very pleased to see the work that ARC West has been doing in collaboration with Health Data Research UK to help to ensure that we can apply health and care data to understanding the epidemiology of COVID. And then last but not least, we as a funder are looking at what we can do to get rid of bureaucracy, which adds nothing to the quality of the processes that we run in a way that doesn't compromise patient safety. So last slide, please. So just to conclude then, as a funder, a co-funder of the ARCs for NIHR, what I am looking for from you is summarised by that little acronym. So one is that ambition, the ambition to really reach through to your local communities, to the health and care system, to understand the health and care issues that face your populations, and to have a high ambition for addressing those. Secondly is reach, so that reach through to all communities, and that's something that we're looking to focus on across NIHR and looking to support the infrastructure that we support, is how do we form engaging interactions with our communities, not just tactical engagements when we want people to participate in research, but how do we really engender a community interest in identifying what the issues are and what the best mechanisms for structuring research to address them are, and the best way to get that research evidence out to the people who need to be able to act on it. And lastly, the importance of collaboration. You've got a great collaboration in ARC West. What more can you do to really reach through to all the organisations who can help progress your agenda? Thanks very much. Thank you, Mark.